I've worked in hospitals where a lot of people had never been given the education to try and help them avoid being where they ended up. We didn't have those discussions with people, that if someone had a high blood pressure, the treatment option was to up their blood pressure medications rather than talking to them around diet and exercise. I'm Sarah Harwood. I'm a nurse working in general practice at Turn the Corner Medical Clinic. I started nursing after leaving high school in New Zealand, and then I decided to go overseas. I worked in the hospitals there. I did district nursing, I did community nursing, being away from home in very foreign environments with very different ideas of health and well-being. I still enjoyed the nursing but found that there was something lacking in the care that I was able to provide. So when I moved to Australia, it was a really good opportunity to try and move into primary healthcare. I see people of all ages, so you build some really long-lasting relationships with patients. You become kind of part of the healthcare family of them. There's a lot of organisation involved in my job, so I'm responsible for all the clinical reminders that happen in the practice, so if anything needs following up, it's done through me. There's some skill sets that you do need to develop. When I first started practice nursing, I'd given maybe 2 or 3 intramuscular injections because in the hospitals the majority is intravenous. So it was something I was really not very confident at doing, whereas now I'm very confident at doing it. I'm really part of the healthcare team. My opinions and my assessments are really valued by my GPs that I work with. They know where my strengths and where my weaknesses are, and they're able to support me and help me grow as a nurse. The other real benefits of practice nursing is the lack of shift work. I can have a life, I can have hobbies. Being able to say, yep, I'm free every Saturday is fantastic. It's something I've never had before. I think it's all very well thinking practice nursing is what nurses do when they leave the hospital, when they're over the hump, when they just want to go and have a cruisy job. And now that I do it, there's just so much scope because you can find your niche, you can find your interest, and you can develop that and be really interested in the care that you provide.